All good.
Hello and welcome to another fresh dental shadowing session. Today we have Dr. Moayyed, and he'll be presenting, and you may take the floor.
Hi, everyone. Thank you for joining tonight. I'm going to go over this dental experience that I've had with you. Hopefully, you guys can get something great out of it, learn something along the way, and feel free to ask any questions during the presentation, after or in this chat box. I'll be happy to answer any of your questions. So, like I said, Dr. Aidan Moayyed from Houston, Texas. I'm currently practicing in Houston, Texas. Today's presentation, what we'll be discussing, it'll be introduction. So we'll go through my background, kind of where I'm from and how I got to dentistry, my education, the schooling I've gone through, the practice of dentistry, what I do on a day-to-day basis. I'll talk a little bit about the mission trips I've done and how that might be valuable to you, both as a pre-dent and a dental student later on in your career. And then I'll discuss what an ideal dental school candidate should be like. I think, having talked to many of my colleagues now that have gone through dental school, I have an idea of what could make you competitive. And I know when I was going through dental school, I just wanted, the people that had done it to basically tell me, hey, this is the check boxes you need to have to be a good dental applicant. And then finally, summary and then just questions. So to start off, why dentistry? So I come from a line of dentists. I have a good number of family that are dentists. But I didn't start off wanting to be a dentist. I was born and raised in Iran until the age of 10, and then we moved to the States. And from the get-go, I always wanted to be in the healthcare. I wanted to help people. I wanted to work with my hands. And so I started off with the medical school route. As I got to college and I did some shadowing, I worked as a medical assistant, and I kind of got to experience what it was like, life was like on the medical side. And then I also had family, as I said, that were dentists, so I got to shadow them too. And I think dentistry for me was the better fit because one, schooling is shorter. Most importantly is you're helping people on a day-to-day basis. So people come to you with pain or they have, cosmetic issues that they're worried about, or their children have, issues that need to be resolved. So you're directly making their lives better. And that's a pretty important aspect that once you're doing it and, you're making an impact on people's lives, it becomes a more enjoyable day-to-day work experience. Also love medicine. I've always wanted to be in the healthcare field, like I said. And then another thing for me on a personal note, it was hands-on. And that's where the different factor is between medicine and dentistry. In dentistry, you have to understand that your day-to-day, you are hands-on. Everything you do is with your hands for the most part. So, if you're the type of person, I always use the example, if you're the type of person that likes to just teach and educate the patient and would prefer to be less hands-on, medicine will probably, certain areas of medicine obviously are a lot more hands-on, might be a better fit. But as a dentist, you are teaching, you are helping patients on a regular basis, teaching them and telling them what to do, but you're doing hands-on work such as cosmetics, pros, root canals, cleanings, and then also my favorite, which is surgery, which leads to the next one, which was I always wanted to do surgery. I always, gravitated towards, I guess, bloody stuff, which is not a good thing, I guess, maybe. But surgery was the biggest selling point for me. I saw that on a day-to-day basis. You can do extractions, you can do bone grafts, you can do gum grafts, you can do implants. So from that perspective, that was another important factor. And then the final one, which is quality of life. At the end of the day, you want to be able to make a good income for yourself and then your future family, or your children or wife, whatever it may be. And then you want to, not take your work home. Right now when I go to work from 9 to 5, sometimes 9 to 6. Today I got home at 6. And then after that, I'm done. I can relax. And then my weekends, right now I'm working 2 weekends a month, 2 Saturday, but that's because I just started out and I have the energy for it. But that's also a factor. So you need to take into consideration quality of life. That if you don't enjoy interacting people on a day-to-day basis, and you're more like want to sit back. Dentistry is a very social career. You don't interact with a lot of people. You don't have a lot of peers, but you have to interact with patients on a day-to-day basis. So you have to be good at reading people and kind of gauging your personality or changing your personality based off of how each individual reacts to being at a dental office, which a lot of people don't enjoy. But overall, the quality of life in dentistry, from what I saw from my family, relatives, is pretty good. And this picture is a picture where I was in Jamaica on a mission trip. So that's a very fun, little trip that I had that I'll talk to you guys more about. So education. So I went to the University of Texas in Dallas. I'm from Texas. So I went over there for my bachelor's. I got my bachelor's of science in neuroscience and a minor in business administration. Graduated class of 2015. First 2 years, I had a lot of fun, so I did kind of slack a little bit. So I had to make up for it the final 2 years. I had a GPA of, I think, 3.35 when I graduated from UTD. In that time, though, I had a lot of leadership positions. I played rugby. I played soccer. I was also in a fraternity, so I got to join a lot of leadership, positions. I got to do a lot of community service through those organizations. So I think that part was very helpful in me getting into dental school because it made me a more rounded applicant. And then also during your undergrad, that's when you're going to start having to work on your personal statement. So I would always say kind of start having an idea of what your personal statement's going to be like, a year or 2 years before. Just kind of build it, whether it's going on mission trips. For me, I did Texas Mission of Mercy, which is a nice little volunteer program where you can go into socioeconomically disadvantaged areas and help out. And I got to work with a lot of dental students at the time, and that kind of built the passion for me to want to be a dentist even more. So it's not just your grades. Your grades and your DAT are a good portion of what gets you into dental school, but it's the overall, resume. Dental schools want to see that you're someone that's well-rounded and can work with a team and can interact with everyone and, have, interest outside of just dentistry. I think that helps a lot. And then, around your 4th year is when you're going to start, after you've taken your DAT, you're going to start applying for dental school. And then, if you guys ever have any questions later on, I'll have my email and Instagram page. You can always send me a message about how to prepare for the DAT. I feel like after 10 years of studying and schooling, I have a good idea on how best prepare for it. So I'll be more than happy to kind of guide you through that. And then after that, after I graduated in 2015, I applied to dental school. So I applied twice. So if there's any of you out there that, are on your second application or third, don't get discouraged. That's part of the process. I applied once. I hadn't heard anything. So I decided I didn't want to sit around and just wait. So I decided to start my master's. So I started my master's. I moved back to Houston where my parents are, and I started my master's in biomedical sciences. And I did get an interview, so definitely apply. Even if you don't think you're going to get in, apply. Because I remember my guidance counselor in my undergrad told me not to apply because she didn't think I had a chance. But I did, and I got an interview, and I got waitlisted. But, still, you have an opportunity to get your reps in, get interviews, and kind of get an idea of what the interview process is like. So I didn't get in that cycle. I started my master's. I did my master's, and in my master's, I had a 3.97 GPA. And I think the biggest catalyst in me getting into dental school was my master's, because it showed that I would be able to handle, tougher, higher, um, courses. So for dental school to see that and see the consistency through my master's to get good grades, I think was part of the factor as to why I got into dental school. And so this summer of 2016, I applied to dental school. I got 3 interviews. And of those 3, I took 2 of them. And the reason I didn't take the third one is because I got into Tufts Dental School. Tufts Dental School is in Boston. I never knew anything about Boston, to be honest with you, but I got accepted. I had a lot of family and friends that knew about Tufts, and they all thought it was world renowned. So I didn't take the third interview, and I went to Tufts. 4 years, I think it's a great school, although my experience is probably very vastly different from any other class that has graduated from Tufts, in the sense that I graduated during COVID. So I got into clinic in 2020 or 2019, and obviously COVID happened in 2020, and I wasn't in clinic for about 6 months of those. So I had my last 2 years of dental school, just like everybody else in my class, was a kind of a bitter experience, in the sense that you didn't get all the clinical experience that you wanted. But with that said, I still managed to build relationships at the oral surgery department. I had a lot of friends that were oral surgeons in that department, or residents. So I would go up there when I had free time, which was a lot. And I think I ended up graduating with having done, the requirement was to do 5 extractions, and by the time I graduated, I had done, I think, 350 or 400, I'm not sure. And I even placed 2 implants while I was there. So the point is, the circumstances, you make what you want out of any circumstance. So, in that situation, I found an opportunity where I could at least expand on my surgical skills by going into oral surgery department, and I did that, and it was very valuable in coming out in private practice and being able to immediately do surgical extractions and bone grafts is, I think, a very valuable experience. And then I was, again, one of the very lucky few. Tufts usually has a 5-week externship for all dental students. It's a opportunity for you to go for 5 weeks at a site, most often not outside of Boston, and work in a clinic that's similar to a private practice. And that kind of gives you a feel for how private practice is going to be like and how fast your speed has to get. You also do a lot more during those externships than you do anytime during the clinic in dental school, because dental school appointments are a lot longer, typically 3 hours, and it's a lot more thorough. So again, I was one of the lucky few, because I think only 10% of the class got to go on these externships, and it was kind of a lottery. And I got it, so I got to get more experience out of it. But all in all, I think it's a great dental school. It's in a great city. Take COVID out, I know a lot of people that have graduated from Tufts Dental School that have gone on to be very successful. Clinically, it makes you a strong clinician. And outside that, they have all the specialties, and they're big on research. So if you're interested in going into a specialty, having all the specialties in the school will allow you to get more exposure, build more relationships, and obviously when it comes to applying, you have kind of that leverage point. And if you're interested in research, they also have a great research department that that you could easily transition to. So all in all, I think it's a great school. Again, I came out of it, from COVID, so I didn't have the most amazing experience as somebody else who graduated in 2019. But so I graduated, and before I graduated, I did some mission trips. Like I said, Texas Mission of Mercy, before I got into dental school, I had about 2 years where I had a friend who was in dental school at UT Houston, and I would always go on these trips with him. We would go around Texas, and I would always assist him, so I got to learn what a dentist is life is like and what the job entails by doing that. And you also, when you go on these trips, you know, you get to meet a lot of dentists, a lot of dental students, and it's fun. You know, you get to meet people and you help the community and you learn. And you know, there's so many pros to it that I think everyone should try to volunteer as much as possible. And then during dental school, this is the group I went to Jamaica with. It was a week-long trip. We were there for 6-7 days, and we worked for about 5 of them, and we had really 1 day off because the other one we were traveling. But it's a fun experience because, you know, the most important thing is it humbles you because you realize how appreciative people are of what you do and how impactful your job can be towards people's lives. So in that sense, it humbles you and makes you appreciative of the profession. You're also helping people, and you know, you're getting experience. I think in 1 day I did probably 20 plus extractions, 20, 30 plus extractions. So you're getting experience, and then, you know, you build friendships and long-term like relationships with a lot of, you know, the people. We still have a group text with all the people that went to Jamaica that we still keep in touch. We still talk. We just still reminisce on it. So I think before you get into dental school and while you're in dental school, try to go on these mission trips because it gives you an opportunity to, you know, become overall a better person and a dentist. So I did that, I think my 3rd year, and this was actually it was January, so about 3 months before the pandemic happened. And then unfortunately we couldn't go our last year because of traveling restrictions, obviously. So I graduated in 2021. So I'm a fresh new dentist. I started working, you know, 7 months ago. So I kind of have a fresh new perspective as opposed to a lot of the dentists that, you know, you have talked to you guys where, you know, they have more experience. So, but nevertheless, you know, it's been a good journey so far. So now I'm in a private practice in Houston. I actually work at 3 different offices. I work 2 Saturdays a month in one office, and then I'm at 2 private offices, one on the southwest side and one on the north side of Houston. And so just to kind of go over what's the deciding factor when you're picking a job. First and foremost, the most important is location. So for me, it was really just Houston when I was applying. I also looked at Chicago and Boston, but location matters, whether it's your family. For me, I wanted to come back near my family because that was more important to me. So after that, then you kind of start looking at what the office is like. So the most important thing is the office culture. Okay, so you have to weigh that immediately. You have to see, you know, I've in my 7 months of working, I've been in offices that have been run very poorly, and if the management isn't done well, then your experience as a dentist is going to be affected as well. So you want to make sure from top down, offices managed really well. You want to make sure the culture is good. There's no drama or cattiness or, you know, animosity. Everyone's working together towards a common goal. Okay, that's important because your production will also be higher. Because once you graduate and you're a dentist, in all likelihood, your salary is going to be based off of production, how much you produce at the office. So outside of the office culture, you also want to look at the patient population. You know, depends on what kind of patient you want to work with. You know, do I want to do more cosmetics? If you want to do more cosmetics, well, you have to try to get to more high-end, you know, locations. You know, do you want to do more pediatrics? I do a lot of pediatrics. I see a lot of kids on my day-to-day basis. In dental school, I never saw kids. I thought I hated working with pediatrics, but you know, it's something that I enjoy now. I wouldn't say I want to do it for the rest of my life, but it's a good experience that I've had so far. But you have to kind of figure out what kind of patient population you want to go with. And obviously when you graduate right out of dental school, your selection is going to be a little bit more difficult because you're basically at the bottom of the barrel. You know, dental school gives you experience, but you really don't have much experience in the grand scheme of things. So I just looked at the contract, the office that gave me the best offer in terms of production numbers and, you know, what the reimbursement rates were for lab fees and what are the benefits. So I kind of made my decision based off of that. And then you also want to look at if there's mentorship involved too. The office I'm at right now, the dentist is been like a long-time mentor of mine for 10 plus years. She's the one that wrote my letter of recommendation to dental school. So it was a good opportunity for me to get in, especially early on, and kind of learn from her. And every day, just today, you know, she sat down with me and discussed the case with me and how it can be improved and how it could be made better. So mentorship is important. If you can have, even on a phone call, if you can find mentors where you can call them on a quick notice and say, hey, I have a question about this case, what do you think? It doesn't have to be in the office. I have cousins in Canada that are dentists, and I call them regularly to ask about a case, and you know, they happily guide me. And you also have your classmates and colleagues that you can always call and ask to. So in regards to private versus corporate, I'm not working in corporate, I work in private right now. I think there's benefits to both. I know, you know, some people will swear by, you know, private only. I think corporate, I have friends that are in corporate offices, and their benefits are, you know, you kind of go in and you're just a dentist. The management takes care of everything else. You know, they take care of the hiring process, they take care of assistants. If the assistants aren't working efficiently enough, then you can always let the management know and they can take care of that. And then there's more benefits from what I've seen in working corporate. They typically cover your CE courses, continuing education courses, which is important once you graduate from dental school because you need to continuously learn. So I think they cover up to $2,000. I know one office in Las Vegas, who was a corporate office, was willing to pay up to $24,000 of my student loans yearly, which is a pretty good offer. But the advantage of private offices, again, mentorship and potential buy-in. For me, I eventually want to own my own office. And for me, I thought that learning how private offices ran, especially since that's going to be the next step for me, it would be better to be in a private office. Again, you have to look at your end goal. You have to kind of have an idea of what your 2-year, 5-year, 10-year plan is. And if your goal is, hey, I just want to work as a dentist, I'm not interested in the entrepreneurial side and the business side, then corporate is a great option because you can go in and purely be a dentist. But for me, I've always, the business side of dentistry has always been something that's captivated me and gravitated me towards the field. So I wanted to be in an environment where I could kind of learn how to run a private office. And then, like I said, when accepting a job offer, make sure the office culture, that's the most important. Like anything else you get out of it, just make sure the culture is good. Make sure you like the assistants. Don't just go to the office once and say, okay, this sounds good. Go in there, work for a day, observe and shadow, talk to the assistants, talk to the hygienist, talk to the office manager, talk to the dentist that's there, and really pick their brain. See if you mesh with them, and if you get along with them. If all that works, then I promise you everything else will come. If you work hard, then you can definitely produce, and you can definitely be in an environment where you can stay in that office long term until you're ready to open your own. So that's my practice. And then what do I do on my day to day? So my typical day to day is, I see it's kind of fluctuates right now with COVID, especially the past month with Omicron. It's been a lot slower, but typically on a day-to-day patient, you see anywhere from 20 to 30 patients. A lot of my patient population right now, like I said, is pediatrics. So I work with a lot of kids. You do a lot of fillings. Your bread and butter in dentistry is your day-to-day. So you do a lot of fillings. I do fillings, crowns. I did 4 crowns yesterday in, 3 hours. You do root canals, and I have a couple cases right here that I just did a couple root canals in the past 2-3 weeks. And molar endo is not something you really do in dental school, at least for my dental school. Maybe other dental schools, they do that. And that's another thing you need to look into is what school gives you the most holistic experience. But it's something where you kind of, with dentistry, there's multiple factors in being successful. One is being able to learn, and not getting upset if, for example, someone tells you to do something better. Ability to learn, and then humbleness. So if you have those two and then you have confidence in yourself, then what I've learned is that you can do a lot of dental work yourself within reason, and build that confidence over time. I remember first time I did a filling in dental school, it took 3 hours. Now I do 8-9 fillings in an hour. So again, that's something that with time and confidence comes, but you also have to kind of push yourself to the edge, get yourself out of the comfort zone. And that goes with anything as you're applying to dental school. Push yourself out of your comfort zone in dental school. Push yourself out of comfort zone. Go talk to the various departments, build relationships with them, because that pays off. Getting out of your comfort zone, I think, pays off more than anything else. And then bridges, dentures, cosmetics. I have this lady right here that we did 6 crowns on. She wasn't happy with her smile. She had gotten a 4-unit bridge from tooth number 7 to 10. She wasn't happy with that, and so we kind of extended it and got a 6-unit, 2 single crowns and a bridge, and then we delivered it. She was very happy with it. But another thing is, the toughest part of dentistry is it's not the procedures itself. The toughest part is patient management and office management. So how do you deal with your patients? How do you make your patients happy? How do you build the what's the word for it? The standard, the bar. The expectation. Some patients just come in expecting way too much, and they don't typically have the ideal occlusion or ideal oral cavity for the ideal treatment. So you kind of always have to, expectations have to be set at the beginning, early on. And, even when you're in dental school, you have to kind of talk to the patient and, let them know that you will try to get it perfect, but it's not a perfect profession, and, you do the best you can. But all in all, we discussed it with the patient. We discussed what the results could be and what they could come out as, and the patient understood. And when they got the final, restoration, they were very happy with it. So on a day-to-day basis, since I'm a general dentist, I kind of do a little bit of everything. Obviously, as a specialist, you are, and an endodontist can do the same root canal I do probably 1/3 of the time or half the time. So if there's an area of dentistry that you really enjoy and you really like, or there's an area of dentistry that you really hate, so then a specialty would make sense. I have friends that really, really love surgery, so they went into surgery. I have friends that really like endo, and they went into endo. And then I have friends that just hated in dental school all aspects of like fillings and all that, so they went into orthodontics, which is kind of a little bit outside of dentistry to an extent. But yeah, I like all aspects of dentistry. I really enjoy it. I like to have variety throughout my day. And so for me, general dentistry was the best fit. And I had been in school for 10 years. I kind of wanted to start working and kind of feel it out. So if, in 2 years, if I decide, okay, I really enjoy root canals, I just want to do a root canal, I can always go back and get a specialty. And that's the beauty of dentistry. Outside of oral surgery, I think you need to go into oral surgery. It's more favored if you go into oral surgery early on. Not saying that you can't work for a couple years and then go back, but oral surgery is a little bit more demanding in terms of the examination and the program itself. So ideally you want to get in early on. But any other specialty, I have family that worked for 3 years and then they went and got their pros specialty. So that's the best part of dentistry. You don't have to make the decision right out of dental school. But yeah, that's my typical day. And then lastly, I just want to talk about what an ideal dental school applicant is. Through my experience, I've kind of realized what works and what doesn't. Again, I wasn't an ideal applicant. I had a GPA of a 3.3 in 3.35 in college, so I went and got a master's, and then my master's obviously made up for it. But ideally, you want to have above a 3.5 science GPA. That kind of shows the dental schools that you can handle the tough curriculum, and you have the work ethic to be able to keep up with it. DAT scores, I think at the time when I applied, I think the average DAT score to get in was 19. I'm not sure what an average is now, 5 years later, but I think above a 20, you're probably, it's a safe bet for you to get into a school. So those are the two most important factors. If you don't have those, it becomes a little trickier. But with that said, I have friends that have gotten in with 3.2s and 18s and 19s. So I don't want you to sit there and say, "Oh, I have no chance." Like I said, apply, because if there's a chance that you can get an interview, that's all you need. The interview, if you go there and you do really well, you'll be set. And then, like I said, the friends that did get interviews that didn't have the grades, or they had a lot of extracurriculars. So get involved while you're in college. If you're big into sports, play sports, join clubs, take on leadership positions. Leadership positions are important. I think it shows, again, that you can work within a group setting. And dentistry, you're very much working in a group setting. You have to lead a whole office towards a common goal. So I'd look favorably towards somebody who has that. And then mission trips, you want to show that you have some passion and love, for helping people. You enjoy dentistry. And then shadow. I think, like I said, I was a medical assistant for a while, and then I shadowed dentistry. So I kind of got a perspective of, both. And I decided dentistry was for me, and I don't regret it. I love the profession of dentistry. I don't think I can do another job. I enjoy it every day. Every day that I go into work, it's a new challenge, it's a new learning experience. It's new people, new experiences that you have to manage and work towards. So for me, it's the perfect profession for me, but it might not be for somebody else. So I think shadowing and really, going to offices, that will help. Right now, there's a dental assistant shortage, so you can even go to an office and tell them, "Hey, I want to work, and I want to learn. I want to go into dental school." And most often than not, dentists will love that and they'll take you on. And they need assistance right now. So I think that's an opportunity for you, if you're a pre-dental student, to not only make a little bit of money, but also be really there. Because shadowing, you're just standing behind the doctor. As an assistant, you see everything that's being done, and then you kind of figure out whether you want to do this on a day-to-day basis. And then lastly, strong letters of recommendation. And honestly, just reach out to doctors. As I've gotten older, I've become more bold and more confident. So, I've gotten doctors' informations from family and family friends, and just send them a text or send them an email and say, "Hey, I'm a dental student, or I'm, pre-dent student. I'm really interested in dentistry. I kind of want to pick your brain and learn from you. And you have time to sit down." And most often than not, people love to help. I haven't come across anyone that has said no or hasn't tried to help out in some way, because people like teaching, and there could be a lot of good mentors that come out of it. And just one doctor that is a good mentor of mine that, I've hung out with, I've gone to his house now and, met his family, and, very nice guy. I got his number from my friend's mother, who used to go to him as a dentist. And I just texted him, and I was like, hey, like, I'm a dental student, I'm graduating a year and a half, and I just wanted to kind of come in, talk to you, and see what the best approach is in finding a job. And 2.5 years later, we're still, we're friends now. We talk regularly, we catch up. So finding strong letters of recommendation shouldn't be too difficult. You just got to put yourself out there. Just walk into an office. If you know somebody who knows somebody, reach out in that way. And again, like I said, I've been there. So at any point, if you guys need anything, you're always more than welcome to reach out to me. I'm more than happy to help out anyone who's going through this process, because like I said, I've gone through it and I know how taxing and difficult it can be. And with that, we can open up to any questions if anyone has any. And if you guys have any questions, you can always reach out on my Instagram or just send me an email.
I just want to say thank you for a really informative presentation. I really enjoyed hearing about your process of getting in and your daily activities. One of the comments from the comment section are, since you're interested in surgery, have you considered going into maxillofacial surgery residency? Is it competitive?
Yeah, so oral surgery, I did consider it for a while. The reason I didn't end up doing it was because, again, I had been in school for 10 years and I was kind of ready to work. And, I had friends who were surgeons who kind of told me, hey, if my areas of interest were basically extractions, surgical extractions, bone grafts, gum grafts, implants, and as a general dentist, you can do those on a day-to-day basis. I have a cousin who, that's all he does, sinus lifts and all that. He does that as a general dentist. But OMFS is of all the specialties, that's my favorite. It's an amazing specialty. It's a fun specialty, but it's difficult. So you have to understand it, it takes 4 to 6 years. You have to take your CVCSC, I don't know what it's called. So you have to take that exam, and that's the equivalent of the step 1 of medical school's exam. And dental school, unlike medical school, doesn't give you any time to prepare. Medical school, typically right before your step 1, you have a couple months off where you can go prepare. In dental school, you have to manage not only being in clinic and meeting your requirements, but also studying for that exam. And it's pretty difficult, but I think if you're really passionate about it and you want to do surgery, I say get in with that mentality, but also lock in, because you have to be the top 10% of your class. You have to be, because top 10, top 15%. So that means, a lot of times when your friends are resting or just relaxing in dental school after an exam, you have to go sit down and study. And long term, if that's what you're passionate about, I think long term, once you get in, it'll be worth it and you'll be happy. I have a lot of friends that are in surgery and they're very happy with their decision. For me, given what my goals and ambitions were, and again, I gravitate towards a lot of the entrepreneurial business side, I kind of wanted to get going and get started and start making some income to be able to be ready for that next chapter. But yeah, OMFS is great.
Yeah, I personally think, I don't know a lot about Openness, and I think in general, pre-dents really don't know a lot. It's more of a niche, and it's very hard as a pre-dent student to honestly get real experience of that.
Yeah.
But you said how the oral surgeon you talked to really liked extractions, and that's how they went into oral surgery. Do you think in dental school you get enough experience with everything to really decide what you really like, or maybe is it too fast paced and just in general
So your dental school experience is solely dependent on it. So like I said, I know a lot of people in my class that graduated with 4 or 5 extractions. I know a lot of people that graduated with 2. I know a lot of people that graduated with 10. And then again, I graduated with 350, 400 extractions. So I wasn't really up in endo department or ortho department as much, but I just love surgeries. I love doing extractions. I loved assisting in them. I loved going in there and watching implant placements and sinus lifts. And to this day, it's something in my practice. Just this past week, I did 4 extractions with bone graft placement, and I enjoy it. I thoroughly, if you can put my schedule at 9 to 6 just doing surgery, I'd be happy. But your exposure depends on you. The dental school gives you the bare minimum. Okay, it does not make you a great dentist. It does not make you a good dentist. It makes you a competent dentist. That's the goal of dental school. Okay, the goal of dental school is to give you enough experience where you can pass your boards and go out into the real world. That's why, and I didn't realize it until I came out and started working. A lot of dentists laugh at, your minimum requirement in dental school is 40 fillings. In 2 days I do 40 fillings. Your minimum requirement for extractions is 10. I do that like regularly, more than that. So if surgery is something that you're interested in, you have to go into the oral surgery department and just shadow and watch. But I also suggest going into, the endo department. I knew an endodontist up there, so I would go regularly and watch him do root canals, and I think endo is great. So you kind of, as you go through dental school, kind of figure out what your areas of interest are, what you really like, and then you kind of gravitate towards those and find ways to get more involved in those areas. What I would say is the first 2 years of dental school, really, really just lock into getting the best grades you can. I don't know. Some dental schools are pass or fail, so it doesn't matter. Mine was graded, so it was an added pressure in that sense. But you just want to make sure your grades are outstanding. So that way, if you get to 3rd or 4th year and you say, okay, I really want to do surgery, or I want to do endo or perio, you can go do that. You have the, GPA for it, because your 3rd and 4th year, you don't have many classes. So it's not like you can make up for that GPA. So you just got to really go in with a hungry mentality of like, okay, I'm here to work. Let me get the best possible GPA, and then go from there. And then I know some people that have gotten into dental school and they were like, I just want to be a general dentist. And if you want to be a general dentist, just pass. So those people probably had more fun in dental school. So.
And then another question from the comment section is like, you previously mentioned that you had a lot of experience doing extractions, and that's what a lot of oral surgeons like. But you went into general dentistry. So, since what factors made you decide either extractions, so therefore oral surgery, or just general dentistry?
Again, the factor for me was I had gone through 10 years of school. I was ready to work and make an income, and I didn't see myself dedicating another 4 to 6 years to a specialty. So oral surgery is a pretty tough specialty. So your first 2 years, you do you're on call the first year, so you have a lot of 100-hour weeks. You have maybe 1 or 2 vacation weeks per year. So I wanted to get back. My parents were getting older, so I wanted to be closer to my parents. That was the biggest factor. And then also, if you don't get into oral surgery the first time, then you have to do a intern year for a year and then apply again. So you could look at the timeline, if you don't get in, as being 5 to 7 years. If you do the 6-year program, you also get the MD. I just really, like I said, my interest has always been in having practices. I want to have my own practice and eventually have multiple practices. And for me, I wasn't passionate enough I like doing surgery throughout the day, but I wasn't passionate enough to say I want to dedicate another 4 to 6 years. And like I said, I have, 2 cousins in Canada. One of them does, sinus lifts, all sorts of, surgery, um, um, obviously within the oral cavity. The oral surgeon, if you want to do more jaw-related TMJ surgeries or anything like that, obviously an oral surgeon is the one that's going to be able to do that. But within the oral cavity, as a general dentist, for the most part, you can get your fair share of surgery experience. Obviously, you're not going to be as good as an oral surgeon, but like I said, my cousin does the same exact things as an oral surgeon does. So it comes down to you. Everything comes down to you. You can be a super general dentist and do implants and sinus lifts and all the things that an oral surgeon would do in a private office. But for me, I was kind of ready to start making an income, and as much as I love doing surgeries, the passion to go another 4 to 6 years wasn't there for me.
Thank you. And then another question from the comments section is, does dental school teach you the business side of dentistry for those who want to be an entrepreneur? And an extension of that, a question I have too is, would you recommend taking a business minor if you want to eventually own your own practice, for maybe a base to understanding the mechanics?
Answer to your first question, no, dental school doesn't do much at all. So I think the big knock on dental school that they always have is especially as a pre-dent or pre-med student, you have no idea how, the business world works. They don't teach you anything. Like I said, their job is to make you competent in dentistry. So they're not going to teach you how to run a practice. We had a volunteer, kind lady in the school who's the wife of one of the dentists there. She volunteered to teach us a little bit about the business side, and I got to talk to her a lot, and I got to build a relationship with her that I still have to this day. But learning how to run a business, I think it's kind of like learning how to ride a bike, except that bike's going through fire. You kind of have to just jump in. There's not much you can read or do that would really help you really run a business until you run a business. It's the same concept as doing dental procedures. There's so much theory you can read, and then you get in there and it's not an ideal situation. You kind of have to figure out how to work within less than ideal situations. So I would say what I started doing, which I wish I would have done, when I was, 20, 19, during the pandemic, I started reading a lot. I started reading a lot of business books and, books about finance and how to invest your money and, how to top businessmen, run their business. There's books. There's a book that I'm reading called Titans of Dentistry right now. It's a questionnaire about a bunch of successful dentists in various parts of the country, and they kind of talk about how they run their business. There's a book called Dental Practice Hero about this doctor in Chicago or Illinois. His practice is producing about $4 million, and he kind of breaks down how it's done. Those stuff you kind of just have to kind of go searching for it on your own, and I enjoy those books. So I'm constantly reading. Every week or two I'm on a new book, whether business related, and then you read about entrepreneurs that are doing really well. Like I read Shoe Dog about the founder of Nike and Elon Musk's biography. So you kind of get an idea on how an effective leader runs a business. But to really get a grasp of running a business, I feel like you have to be in an office, and then you kind of, the dentists I've talked to, they all said, at some point you just got to jump in. And then in regard to getting a minor, I got a minor in business, and tell you the truth, I don't remember a single thing. I thought it was an absolute, looking back, it was an absolute waste. I got it for that same reason where I was like, oh, that'll help me down the line now. I think a better option is if you wanted to really, and I have a friend she has about, I think, 4 offices in Dallas now, 4 or 5. Immediately out of dental school, she went and got her MBA. and that's probably more valuable. But a minor in business administration really doesn't give you enough information to be able to run a business. If anything, just going to a library and opening up some books will probably give you more information than getting that.
Appreciate it. And that's all the questions I have for today. I really want to thank you again for coming on here, taking out the time of your week to present. Your presentation was really informative, and you answered all of our and the comment sections really well. So I just want to extend a thank you and for coming on to our organization and presenting.
Appreciate you guys having me. Thank you so much.